All right, in this video, I want to go over a protocol to help release the tissues of the feet. So first, I like to start off with rolling out on a lacrosse ball. You can use something similar to this, but I like the feel and the density of this ball. So I like to get in all the little crevices, and you kind of push the bones with this. So when I'm underneath the toes, pushing up underneath helps to create space in there. But you don't want to really crank on it because they can be sensitive to change, at least in my case. So I like to get in all of that and along the heel and in the arch. Now I'm doing this sitting on the floor, so there's not as much pressure. I will do this sitting on the couch or a chair. You can do this standing, but that's not my favorite position because sitting, you're gonna keep your hips more even and you don't have to worry about really stabilizing as much. So do this on both feet. I do it just as long as I feel I need, typically at least a minute on each side. Next, take a jump rope or any sort of rope. You can take a wooden pencil, something that's going to be fairly stiff and can give you some good traction, and position it to however's easiest. But I like to be able to have my shoulders relaxed. Now you can either pull with your arms and let your feet relax, or you can push into the rope by pointing your toes. So try both of those and see which one works best for you. I would spend at least 2 to 3 minutes in between each toe because a lot of times the releasing doesn't happen until a little later on. Now, if you're tighter on time, then I would just go in between on either side of that middle toe because that's going to connect more with your midline and help work up the kinetic chain. At least I find that happen more often. So spend some time on that, both feet, and then I like to release the muscles of the lower leg. So I like to be in this diva position because I can push down. I feel like it helps give a little more traction, kind of like you're rolling out pizza dough. And then if I find a spot, I might kind of wiggle back and forth and roll it out even more in a different direction. So obviously you can give yourself more pressure if you're putting more body weight onto the roll. For the calf, I like this because I can get at it from more angles. So back and forth. If I find a really good trigger point or a spot that kind of gives that like feel good pain, then I do a little more of a rotational movement on it, or you can actually just slide back and forth. And also when you come to a point like that on a little more tender tissue, you can, or if the tissue is really tight, go into foot circles. So you want to do maybe 30 in one direction, switch to the other direction and do 30 there. And then some point flexes. This is going to really hydrate that stuck tissue. And then to finish it up, now that everything's loose on both legs, is you do just some mobility exercises. So you're gonna spread your toes. I like to do like 5 to 10 seconds, and then you're going to squeeze your toes and curl them in, and then go back and forth. I would do that about 10 times. So you're spreading, try to really access the toes that you can't move. In my case, My pinky toe on my right side doesn't like to move, so I really work on trying to get that to move. So sometimes you have to put your mind to it, but just go back and forth. Doing this every day is really going to improve the flexibility and strength in your feet. Thanks for watching. I'll see you next time.